Hello everyone, welcome back, and this is Thank GH. My name is Anita. Today we will be talking about the evaluation station of the midwifery Osce. If you have been watching my previous videos, we started with the assessment, planning, implementation, and in-depth tutorial on how to fill a meal chart, and now we have the evaluation. Stay glued to your seat, go nowhere, and hope you enjoy this section. The evaluation station of the midwifery Osce is also 15 minutes. You are given a different pen color to write it. Why? Because all your documents, all scenarios that was used from the assessment, planning, and implementation station alongside your meal chart will be given back to you, because you need all those information from that same patient in order for you to give an evaluation. Evaluation uses the Sbar system, and which other station uses an Sbar? The planning. So the planning and the evaluation station are both an Sbar. This is super quick because we did an in-depth studies on how to fill an Sbar. If you watch the planning station, we did how a situation will entail, how the background will contain the recommendation and the assessments. The situation, the background, assessment, and the recommendation. With the evaluation station, you are given a whole new scenario over again, and this time they will tell you that assume it is a day later or assume it is 2 days later. They always make it futuristic so that you will now plan the care for the patient when she is being discharged. So you are going to write everything in an Sbar. This time when you look at the scenario, they may tell you that patient Juliana has been taken care of the following day and now she is feeling better. Her CTG is normal, her observations are normal, her urinalysis, she has been prescribed with the right antibiotics and given a start dose and a continuation dose. So what are they trying to tell you? They're giving you all those hints in order for you to write either a discharge letter or a transfer letter. Both of these are supposed to be in an Sbar. So what will be your situation? Your situation is going to be your situation is going to entail the patient's details and what the patient is. So for example, I am Anita, who took care of patient Juliana Mensah, hospital number, this date of birth, who presented with abdominal pain and abdominal pain and vaginal bleed on this date. Then the background, ask me what the background is. The background is going to entail all the assessments you did for the patient, the implementation, that's the drug you gave to the patient, the planning. All those things has now become a history because it is a day later. So you are assuming that you are in the following day. So all those things you did for the patient previously has now become a history, and that is what needs to go in your background. With the planning station, the background was all the history you gave to the patient. That's the past medical history, past obstetric history, medication history, allergies. This time the background is going to be all the assessment, the planning, and the implementation station will now be converged into a single thing and now be used as the background. I hope you understand the difference with the background of the planning and the background of the evaluation. The assessment station is the shortest of it all. Why? Because you will now visit the evaluation scenario given to you and the instructions that was written in it. For example, if the doctor had written in it that patient observation is normal, CTG is normal, fetal heart rate, everything is reassuring, your assessment is going to be what is written in the scenario of the evaluation. So this time the assessment will not be the meows chart you filled for the patient in the assessment station, because that is a history. The assessment is going to be the current state of the patient which the doctor has reviewed with. So you can say that the assessment is going to be that doctor has reviewed patient doctor has reviewed patient, and patient is having normal CTG, all those things, blah blah blah. Then you are done with your assessment. You move on to the diagnosis. This time patient is going to have a final diagnosis, which might be one of the differential diagnosis you give. It will be indicated in the evaluation scenario, so you pick it up and add it to either your situation or your assessment. The recommendation also, most of the time, this is where I always say that it is all the knowledge you have, because we haven't got much, but we have the very most important thing. That is, if you look at your evaluation scenario, they always indicate that doctor has reviewed Juliana Mensah. Therefore, write a transfer letter or a discharge letter to the community midwife or to delivery, wherever the location is going to. That should be your very first point under the recommendation. So if he's saying that, write a transfer letter or a discharge letter to the community midwife. Say that the first point for your recommendation will be that patient is to be transferred to the community midwife. Now, looking at the diagnosis that patient is with, you also write patient medication, because if patient is having a regimen, for example with the implementation, patient was administered with ferrous sulfate and it was for 2 weeks. Therefore, you need to write that particular medication regimen on it, so that to remind patient that patient is supposed to continue with this medication. The start dose medication are now history, because it's a once only medication. That means that that particular drug needs to go to the background. The recommendation must talk about the future medication that patient is supposed to have. Also, if you look at ferrous sulfate, if ferrous sulfate was to be administered, then it would have been part of the background, but ferrous sulfate was not administered. Therefore, it goes to future, because it said this medication needs to be consumed for 2 weeks. You also need to write that patient will need to call back or visit back the clinic if she has any concerns. I hope you understand. And any other health education you can give to patient. Probably look out for early signs of labor. If you look at patient gestation, probably in the question you were giving like patient is 40 weeks or patient is 39 weeks. Definitely patient is in the term stage, so patient can go into labor. So you can equally add all those points as a hint. I hope you've understood it, and this is very simple. Recommendation is always in an Sbar. Planning station is always in an Sbar. Never forget this. Make sure that your write-up are in the Sbar, and this is also a silent station. You do not perform anything to the examiner. You do not perform whatsoever practicals. I hope you have enjoyed this. The next time we meet, we are going to talk about the tooling station, and that is usually newborn examination or or delivery or maternal observation. I hope you enjoyed my video. Please do share my video. Thank you so much. Enjoy the rest of your day. Bye.